And in the time I have left, I want to focus more upon what I would consider some very important information regarding the transgender movement. There's a few articles, and I'm sure if you go online at all, there's all kinds of YouTube videos. There's documentaries happening. There's a lot of information floating out there now regarding the transgender ideology and the transgender movement and so on. Some of it's quite helpful. And so I want to just refer to a couple of them that I have found some helpful information on. And one is it's a YouTube video that I listened to. There's a full episode called Parental Trauma in a World of Gender Insanity. And that is an interview between Dr. Jordan Peterson and Dr. Miriam Grossman. And then there's a shorter part of that, which I did listen to. It's another YouTube video called The Monster Behind Gender Theory and the Atrocious Lie He Based It On. So this is going back to analyze the origin of this gender ideology. Where did it come from? Who started it? And so on. And it's quite an amazing story. And so, and I'll just give you a little quote that's associated with this. Dr. Jordan B. Peterson and Dr. Miriam Grossman walk us through the horrific yet true story behind the Reimer twins, the atrocity of their upbringing, branded as a successful experiment by Dr. John Money, was used as the bedrock of gender and identity ideology that has captured the Western world today. And so the story starts back in possibly the late 1950s, but at least into the 1960s. I'm just going to give you some of the information that I gleaned from this. Dr. John Money was a professor of the Johns Hopkins University in Baltimore. He was at least functioning in the 1960s, and I'm not sure when that would have ended, but it was up into the 80s probably, or 90s. I believe he died possibly around 2007 or so. He specialized in sexual and gender identity theory. Now, he was one of the first ones, at least, to popularize this idea that gender is not innate. It is not related to genetics. It's not related to biology. Now, that's news to most of us because we logically associate it with what our biology is. And so his theory was that gender is merely a social construct imposed on infants by parents and others around them. Now, this is where you get this term that you hear over and over again today by those promoting transgender ideology. They'll talk about gender assigned at birth. I'm sure you've heard that expression, assigned at birth, as if somebody, had their clipboard out and just, well, I'm going to assign you to be male, I'm going to assign this one to be female. Of course, the correct language would be gender observed at birth. that would be a rational description. And so this is the idea that gender is something sort of imposed upon the infant. And so he had actually opened a clinic dealing with children born as hermaphrodites. That happens to be a very rare condition, which is due to chromosome defect, in which it is not determinate which sex the child is. And in nearly all those cases, the decision would be to make the child female, because that's the easier way to go, logically. Now, a personal detail about his own life, I think, is quite relevant to the course of his life. He had a very unpleasant childhood growing up. He had an alcoholic, abusive father who beat his mother and who also beat him. And it made him ashamed of his own masculinity. And it's very likely that that influenced his own perceptions of this whole realm of male-female gender. So he had this thesis, but to prove his thesis, he needed an experiment. And that experiment became possible through a couple from Winnipeg in Manitoba. And I'll just give you a bit of the history of this.
Well, we'll wait for Bruce to come back on and pick up where he left off, hopefully.
If he disables his video, would that help? Or if he's got such a slow connection?
Zoom automatically adjusts video somewhat, like it has been, but I suppose it's possible. I don't know. Hopefully he realizes he's no longer connected.
So are we back on?
We are back on. So he must have
lost my connection here, and I'll see if I can get back to where I was.
So basically, the last we heard was you mentioned that he had a very unpleasant childhood, and to prove his thesis, he needed an experiment. So that's where you went.
Okay, I'll just pick up from there then. Yeah, so in August of 1965, there was a young couple, a Reimer family from the Winnipeg, Manitoba area. They had twin boys. And they were born with a condition called phimosis, which made it a requirement for them to be circumcised. And kind of tragically, the doctor who did the procedure used some kind of cauterization method instead of the usual method of circumcision, and actually damaged the one boy to the extent that his penis was destroyed. The second boy, they didn't touch, so he was spared. So the parents were obviously very, very distraught and didn't know what to do with this situation. What are they going to do? And then they happened to see a TV lecture by this Dr. Money that seemed to hold out some hope for them. So they contacted him. They went down to the Johns Hopkins University in Baltimore, and he assured them that the best thing to do for this little boy would be to raise him as a girl. And he assured them that that's, you can handle this, and that he will be fine as a girl. And so they finished what they needed to do surgically to turn him into a little girl, named him Brenda, and gave him dolls to play with and dressed him in girls' clothing. And he insisted that they must never tell him what had happened to him. And so from infancy, then this little baby, this little twin is raised as a girl to become a girl. And his brother obviously was a boy. So they kept going back down to this clinic and to monitor it. And this doctor made this his case study in order to prove his theory about gender, that it was actually something that could be formed from the externally to this child, and that it was not innate to the child himself. And it's actually a very tragic story, because he made out that it was very successful, and that year by year, as they followed up and they spent time there, and he did experiments with these kids and so on, that everything was fine. This child was adapting perfectly normally, and they admitted that he was kind of a tomboy, but within limits. However, what the parents did not know was that this doctor was actually, in reality, sexually abusing these children. And he was causing them to do things to themselves and with each other, that was actually sexual abuse. And by the time these boys became in their teens, they refused to go to see him anymore. In fact, the one that became the girl, Brenda, told the parents that she would kill herself if she had to go back. And so they stopped going, but I don't think they told the parents for quite a number of years what actually was behind their reluctance to go. So at some point in their teenage years, the parents decided to tell the children the truth. And for the one that had been, turned into a girl, he was relieved, because he had never felt right being what he was supposed to be. And he reverted back to being a boy. He called himself David, and eventually even got married someone with 3 children, and everything seemed pretty normal. The unfortunate thing is his brother found it very traumatic that this sudden and drastic change in who he thought his sister was. And he actually ended up tragically in schizophrenia. And anyway, as the years went by, both boys ended up dying in their 30s. The brother died through overdose of pills. And they didn't really call it a suicide, but David, the one who became David, who was Brenda and then David, he died by suicide when he was 38 years old. And so what they had gone through had such a traumatic effect upon them that they couldn't ultimately live with it, even though they tried to recover their lives. And at some point, the boys, and it seems like at some point they learned that this doctor had used their life story as this great grand experiment that proved his theories and gave him tremendous prestige and credibility in the research community and so on. And they ended up taking interviews. I think I saw an interview with Oprah with the family. And there was a book published somewhere around 1998 exposing their story. And it was before this doctor passed away, but there's no record of him ever acknowledging what he had done and the falseness of it. And so it's an amazing story. And it's hard to believe that such a horrific story could actually be the foundation of transgender ideology today, but it is. It seems like it coincided with the sexual revolution of the 60s, the rise of feminism, and the gay rights movement that followed along. And so there was this whole framework of throwing aside all the standard understanding of who we are as human beings, our maleness, our femaleness, our sexual identity, and so on and so on. And in that zeal to destroy the bondages of the old, to ignore the most basic realities. And so it is very sad that this is the very flimsy. Just imagine, it's hard to imagine, this is one single study on one set of twins that was supposed to be the proof, the very foundation for what is so powerful today as a movement. And so it gradually became accepted as being, solid scientific truth. Now, I found that a pretty fascinating story. Then there's another article, and this is another. It was a lecture by a woman named Abigail Schreier, and it's entitled "Science, the Transgender Phenomenon, and the Young." It was a lecture done at Hillsdale College in Franklin, Tennessee, on May the 12th in 2021. And she also wrote a book called Irreversible Damage: The Transgender Craze Seducing Our Daughters. And that book was put out in June of 2020. And what I found helpful in this article is that it gives some valuable insight on distinctions as to who is involved and why. And so I'm just going to give you a little bit of the information that she presented. First of all, one definition of gender dysphoria. What is it? Well, the word dysphoria is a discomfort or an unease or an unhappiness with something. And so gender dysphoria has been, described as a severe discomfort in one's biological sex. And I've heard somebody who I'm not sure if they were transgender or which they were, but they said that they always felt like they were born in the wrong body. Whether it was a man, felt like, he wanted to be a woman or should be a woman, or as a woman thought should be a man, and so on. And sadly, it is a real phenomenon for a few people, but it is a very rare phenomenon. It's been estimated that it's approximately 0.01% of the population. And the interesting thing is that this classic condition was always, up until just in the last 20 years at most, it was always associated with young boys. It was overwhelmingly little boys in early childhood between 2 and 4 years of age. And the majority of them simply grow out of it. There are few who would become usually what was termed transsexual or gay men. But even in those cases, most of them did not pretend to be of the opposite sex, but they just felt comfortable expressing themselves as what they were when they changed. So what has happened recently is something very, very different. And she classifies this as not classic gender dysphoria, but rather what she describes as a social contagion. Now, obviously, that's being disputed. and those involved in the transgender movement would not want to accept that this is really like a social fad, a tragic fad that goes from one to the other. But today, currently, it's almost all teenage girls who do not have the typical gender dysphoria at all. They didn't have this when they were little girls. They have it in adolescence, around puberty. And so this is where it becomes very, very different. It's a very different setting. It's a very different situation. What is different today is this. There is the term that is called affirmative care. Today, what is being practiced is this affirmative care, which means they are immediately affirmed as this is what they should be. And so they are supported in that, in those feelings that they don't want to be who they are. And so they're offered, and sometimes without even having to go to see any kind of a therapist, any medical professional at all, to even guide them or counsel them, to give them advice or suggest alternatives. They're just accepted at face value, this momentary feeling, and they're immediately offered drugs. For girls, it's testosterone, or surgical procedures. Now, for those who are just entering puberty or haven't started puberty yet, they're given puberty blockers. And what does a puberty blocker do? Well, it shuts down part of the pituitary gland that controls the release of the hormones that trigger puberty. And the drug that is primarily used is called Lupron. And one of the ironies is that Lupron has never been FDA approved to halt healthy puberty. It was used for a different purpose. Now, one of the interesting things, again, is that very frequently, children who have some of this puberty very frequently helps individuals overcome gender dysphoria. Now, the rationale that's being used today for using these puberty blockers is to safeguard against suicide risk. And over again, if anybody raises a disagreement with it, they're almost threatened with this idea: you are endangering the life of this child. If you do not affirm them, if you do not encourage them in it and help them in it, you are risking their life. And of course, no parent wants to do that. And no teacher, no healthcare provider wants to do that. And so it puts people over the barrel. But however, according to this author, there are no long-term studies that actually prove that it reduces suicides or even that it produces better mental health outcomes. Now, one of the tragic things about these kind of treatments is that at a certain point, it's no longer reversible. They like to use the term, it's just a pause button. It just puts them on pause, and then when they decide a little later, then they can just go on their way and let nature take its course and let them become what they become. That isn't actually true. What they do say is that nearly 100% of those who go on these puberty blockers end up also being put on sex hormones to counter their natural sex hormones. If it's a girl, they're put on testosterone. If it's a boy, they're put on estrogen. And the tragedy is that if they are both put on puberty blockers and then put on testosterone, that girl is going to be infertile. And so here's a young child who is not mature enough to make such a life significant decision, is being encouraged to immediately go ahead and do this, even without parental knowledge or parental consent. In many, that's the way it is here in Canada. And I know it is in some of the states as well. And so she has no protection from those who love her the most and care for her the most. And there's been some tragic cases that have been discussed and have come to light recently. So, and of course, you know that this insanity of pursuing this and pushing this starts right in kindergarten. Teachers are telling children that no one knows their real gender except themselves, and that little boys can actually be girls and little girls can actually be boys, or some vague in-between identity. And they actually encourage them to choose a new name and to choose their pronouns and so on. And so these are things that just seem so abhorrent and unrealistic, irrational. Now, it says, she said that in this article, that this teenage girl phenomenon is very, very recent. Before 2007, there was no scientific literature on that topic of teenage girls involved in gender dysphoria. It's now been, there's a term has now been coined to, they call it rapid onset gender dysphoria, to make sense out of it. And so what is actually going on? Well, the explanation that this Abigail Schreier mentions is that it's very, very parallel to what we see in cases of anorexia, bulimia, which also affect teenage girls primarily. Teenage girls today have the highest rates of anxiety, the highest rates of self-harm, such as cutting themselves and so on, and the highest rates of clinical depression that have ever been recorded. So there's an awful lot of pain and pressure and stress that they're going through. They're going through adolescence, they tend to struggle, and especially as their bodies begin to change, they often are afraid of it or dislike what they are. And we see not only the normal social pressures that school brings, but also now social media, which simply magnifies it. Now, in some schools, it's been identified that up to 15 to 20% of girls in grades 7 and 8 identify as trans. So there's no fundamental basis for that. There's no biological basis for it. It's something that is happening, that is a phenomenon today. And so we have those who would have what we might call genuine dysphoria, which were classified as those primarily little boys between the ages of 2 and 4. Then you have what's happening today, which is a new phenomenon of girls in their teens. And then the third category that are described are those that are called the activists. And these are people who have an agenda. They're not just people struggling with their life, struggling to make sense of who they are. These are people who want to change the status quo. They want to destroy the normal distinction between male and female. And they are the ones who are pushing for the elimination of the distinction of male and female bathrooms and safe spaces for women in sports and even in the prison systems. It just seems so astounding that this push to bring this into being causes them to destroy what has been recognized, as being protection for women, and so it is just an example of how something that is inherently false, it's inherently illogical, it's also inherently contradictory. And so it ends up even contradicting the feminism of the equality of women, of the protection of women, and so on, that has been such a strong push in the last generation. Now this supersedes that, and it doesn't mesh together. And so the tragedy is that this is all based on falsehood. They have wildly exaggerated the benefits and they have minimized the risks. And at the same time, this cancel culture that we've become so sadly familiar with, that anyone who disagrees, whether it's a doctor, whether it's a researcher, whether it's a psychologist, anyone who disagrees, and there are plenty of medical professionals, both doctors and counselors, who have serious questions about it, yet they're being silenced. And if they disagree, they also even lose their jobs. So another statistic that just describes where it is that in 2007 in the United States, there was one gender clinic. In 2021, there's 300 of these gender clinics. So it's something that has just exploded in the last 15 years, who are providing affirmative care and performing surgical procedures. Now, I just saw a statistic tonight about some of these surgical procedures in Canada. And again, it's the same story. It has just exploded in the last few years. Now, one thing that is happening is that there is detransitioning taking place. And there are at least some encouraging indications. Not only are there people who are choosing to try to detransition, but there have actually been court cases. There's one court case that's been highlighted in the UK. I believe also in Sweden and Denmark and some of these very progressive countries where they've actually brought a halt to some of these strong emphasis and trying to take a step back and examine what's really happening. So I haven't really answered the questions, and I've just tried to give some foundation tonight for us, because I think it's vital that the foundation thing that we have to think of today is we owe people the truth. It's very difficult to avoid being offensive, but we have to let people know the truth, because it's only the truth that can truly set them free and give them hope for what is ahead. One of the sad things that I think about is that tragically, some aspects of this are irreversible. And even if someone wants to change back, there are changes that have happened in their bodies that they cannot reverse. And it's also a terrible minefield for relationships, as well as for issues of salvation and what we do with people who get saved. So some of those questions I might try to take up next week, Lord willing. And I think probably, I'll have to see, but probably if I take one more night on answering some of these aspects of it, and then take up the last three questions on one other night, that should finish what we're trying to do. So we'll just close in prayer. Our Father, we draw near. We are conscious that these are very tragic things that we are talking about, things that are even difficult to talk about in public. But we know that evil has penetrated to the very foundations of what you have created. And the evil one is trying to destroy the very foundation of reality and our existence as human beings, our existence as families and as societies. And so we bow in your presence and pray that you might give us courage, as well as grace and wisdom, to be able to relate to people, to be able to be gracious to people, and yet to be honest with people, so that we might help people to be enlightened or to confront the reality that we have today. We ask for your grace upon us in our Savior's precious name. Amen.